As more groups become available for the COVID vaccine, a lot of pregnant women may be wondering if it's right for them or how it might affect their baby.
And doctors say there are a lot of different factors that women should think about when making a decision.
This is our first baby, so we're definitely really excited.
Tatum Tithoff is due in May. She won't be eligible for the COVID vaccine for some time, but says she'll be taking a pass.
I think the decision I have made so far for me and my baby is that, we're kind of going to go with either a delayed route or not at all.
And she's not the only one with concerns. Dr. Michael Chamise, a maternal fetal medicine specialist with Spectrum Health Medical Group, says a common question he hears is about the mRNA component of the vaccine.
There's two parts of the cell. There's a nucleus and then the cytoplasm. The cytoplasm is actually where the mRNA is. The actual genetic material for all our cells is in the nucleus. The mRNA never effectively enters the nucleus. It has unable to do that. So the mechanism of action of mRNA makes it impossible for it to enter our genetic material and alter it in any way.
He says there are lots of different variables to think about with your provider.
What priority group are you at? What is your risk of acquisition for the actual virus? That includes day-to-day, that includes work environment, that includes sort of home environment as well. The other thing to keep in mind is what is the community transmission?
For Dr. Sheetal Das, an internal medicine hospitalist also at Spectrum Health, getting the vaccine was a no-brainer, even though she's breastfeeding.
I'm seeing COVID patients daily, and I know that the benefits definitely outweigh the risks at this point because I want to be around for my son.
Dr. Chamise says COVID has been shown to have a greater impact on pregnant women.
We do know that when it comes to respiratory symptoms, when a pregnant mom actually acquires COVID, have incidentally been shown to be worse.
The American College of Obstetrics and Gynecology has not specifically recommended or warned against the vaccine for pregnant and breastfeeding women. The group simply says the vaccine should not be withheld from those groups.
The preliminary data that we have is very reassuring that this is a safe vaccine for pregnant women and who are otherwise eligible.
Dr. Doss, along with others, understand the hesitancy, especially since pregnant women weren't involved in the Pfizer and Moderna studies.
I think that the decision is very personal. I really, implore people to talk to their physicians and come up with a good informed decision on whether or not to pursue getting the vaccine.
And that's exactly what Tithoff is doing. After having COVID back in October, she says her baby is perfectly healthy and she'd be more comfortable skipping the vaccine for right now and continue other safety practices.
Personally, for me, because of the experience I had, I think I would be okay without it. It's really just about making an informed decision for you and your child and making sure that, you're on your game, you read about it and you educate yourself and you make the best decision. And it looks different for every person.
And with those differences in mind, especially when it comes to pregnancy, doctors suggest starting with good questions and working together on the best choice.
The priority groups are sort of a first guide, but I think it also has to be a decision that has to be made with a pregnant mom in conjunction with their provider.
And both Pfizer and Moderna are still doing safety testing on pregnant and breastfeeding women who have already gotten the vaccine, perhaps if they're a frontline worker, and they're going to monitor if there are any effects. Dr. Chamise says that Spectrum Health will also be helping in those studies in the near future. So he made a good point. Just because that emergency use authorization happened, it doesn't mean that they're still not doing safety studies.
Yeah, no doubt about it. And it's understandable that people wouldn't want to be the first one in that group.
Lots of questions.
We will see. All right. Well,